If you are a nursing student and you're having trouble with med-surg, especially when you're taking the exams, here is a step-by-step guide on how to tackle those questions. If you're new here, hello, hi, welcome. My name is Judith. I'm an ICU nurse and an FNP student, and I TA at an accelerated nursing school program. When you're taking med-surg exams, the first thing you're going to want to do is actually identify the problem. Which of the things that I'm being told identifies the problem that the patient is having? That's typically the diagnosis. So imagine if we're building on fundamentals, that diagnosis is pretty high up there in ADPI. Okay, so you want to identify what the diagnosis or the actual problem is for the patient. Step 2, you're going to look at all the options and you're going to eliminate anything that's unsafe or delays care and or prioritize ABC. And then step 3, depending on the type of question, if it's priority, then you will pick the safest, most effective. Any other question, you're going to want to link the problem with the identifiable cause. Say you have a 64-year-old male who has COPD and his O2 is at 88% on 2 liters of nasal cannula. And you see something like respirations of 28, heart rate of 110, BP of 138/80, and it asks, what is your priority next step? For example, I have option A is increase the O2 to 4 liters a minute. B, encourage pursed lip breathing. C, notify the provider. Or D, administer albuterol. We're going to go step by step. What is the problem that the patient has? The patient's diagnosis or their problem is that they have COPD. Now, with all the options that we have, we want to think about taking the safest, most efficient and effective intervention. Now, let's look at the options. The first option is to increase the oxygen to 4 liters per minute. Does the patient need? Is that a safe and effective intervention? The goal for a COPD patient is 88 to 92. He's already at 88, so you don't need that intervention. It's unsafe. You can cross it off. Now, the next option is to do pursed lip breathing. This patient is a COPD patient. Is pursed lip breathing advisable, safe, and effective? Yes, it is. We'll hold on to that. The next option is call a provider. Never call the provider. You don't need it if you have a safe and effective option. So once you see a safe and effective option, calling the provider is immediately not necessary. And then the last option is to administer albuterol. Now, based on what assessment? Based on what information? You administer albuterol if there's some sort of constriction going on in the lungs, but there's nothing in the question that says that you've listened to lung sounds to make that determination. I'm going to make a second video with a different type of med-surg question, and we're going to still use the same 3 steps in order to break down that question with the hopes that you all will be ready for med-surg exams.